My church bells are chiming.
All righty, welcome to the virtual family council meeting, everyone. My name is Jamie Rose. I'm your virtual meeting coordinator. So we're going to begin our meeting with our confidentiality statement. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you are in, and we will get you to your assigned ombudsman. And a reminder, these calls have public access and are designed for family members and friends of residents in long-term care facilities. So we'll just review our meeting agenda for this evening. We're going to get our virtual meeting tips from Jay, and then we'll turn it over to Corey for our review of our personal care home guidance. And then they'll kick it back over to me and we'll navigate some of the resources that we thought would be really helpful for family members to know about. And then we'll talk about our upcoming meeting topics. So without further ado, I'll pass it over to Jay.
Thank you, Jamie. Good afternoon, everybody. First thing off, you've all been placed on mute upon entry. We'll open the lines in a little bit so that you're able to share. If you would like to speak or have a question, please use the raise hand feature. Once you raise your hand, we'll know to acknowledge you and unmute your line. There will be polling this evening. Once the poll is launched, please choose the most appropriate selection and hit submit. We'll share the results shortly afterward. The chat feature is at the bottom of your screen. If you have a question for the presenter, please message the chat moderator and they'll ensure that your question is asked. The closed captioning is available during these calls. Please find and enable closed captioning at the bottom of your screen if you'd like to view captioning live. If you need to step away, you can stop sharing your camera by clicking on the camera icon also at the bottom of your screen. You can click on it again to start sharing your camera once again. And finally, concerns or complaints can be directed to me at the State Ombudsman Office. The number is 717-783-8975, or I can be emailed at capital-LTC-ombudsman@pa.gov. And I'd like to turn it over to our fine staff ombudsman from Dauphin County, Corey Hurley.
Oh, thanks, Jay. Okay, so these new sets of guidance from Department of Human Service are in regards to personal care homes and assisted living residences. They came out about a half an hour prior to last virtual family council meeting, so we didn't really get much time to review and give you all the summary that you deserve. So we are going to go over some basics from that guidance. Admittedly, we're not quite experts in it yet, or at least I'm not, but we're going to give you a little bit of an overview. So there's a couple of new or newly defined definitions that are pertinent to this guidance. One is community transmission. So what you need to know is that this is a calculation of what PCR tests, so COVID tests, but not the rapid ones, the PCR tests that take a couple of days to get back, typically. That is how they determine community transmission. Each county will have their community transmission posted on both the Department of Health site and the CDC. They are off by a couple of days because they use different, Department of Health, I believe, uses Friday to Friday, and CDC uses maybe Thursday to Thursday for their 7-day count. But what you need to know is that a high community transmission rate is 10% or higher of positive tests. Then there's substantial, which is 8 to 10%. Moderate transmission level is 5 to 8%. And less than 5% is considered a low transmission for that community. Currently, I checked today, Pennsylvania county rates vary anywhere from 14.8% transmission, which is still high, to 40.5%, which is exceedingly high. It's a scary level that we're faced with right now. Really, within the past few weeks, it's record high transmission levels. So just so you're aware, even though everyone's saying Omicron is not as lethal per se, it is spreading very rapidly. So we'll make sure, I think Jamie's going to give you some information later on in the meeting here about how to get a hold of those Department of Health and or CDC links so you can monitor the transmission rates in your own county. On the Department of Health site, there is information as well as on CDC about whether or not there's more or less cases in the past 7 days than the previous week, how many COVID-related hospitalizations there are, ER trips, use of ventilators, etc. So it's a really good tool to see where your county is at, and they have all kinds of charts that you can monitor where your county is as far as transmission. My county personally has gone down, but it's still in the mid-30s, which is a very scary high transmission level. Another definition that they updated since this guidance was reviewed in June of 2021 is immunocompromised. And I'm sure you've all heard that word, but it really refers to any resident with a weakened immune system. So there's a lot of conditions that fall into that category, and it's not up to us really who is considered immunocompromised. So make sure you consult your physician or your loved one's physician on what their particular status would be. The next section of guidance is in regards to outbreak testing. And they reference what they call the PAHAN, P-A-H-A-N. And H-A-N refers to the Pennsylvania Health Alert Network or notifications. You can sign up for these alerts. They email you any time of day, or even on the weekends, to give you updates on what guidance is offered. Typically, they're COVID related, but I get them on Lyme disease as well, all kinds of health related concerns from the Department of Health. They are long, they are clinical, so you might want to just leave that burden up to us as ombudsmen, and you can always call and consult us. But you can apply to receive those email alerts on the Department of Health website. So they reference what an outbreak is. This refers to any new resident case or any new staff COVID case for a staff member who's been working in the home for 2 days prior to either a positive test or onset of symptoms. So an outbreak is really any test that comes back positive is considered an outbreak, even if it's only one case. So homes can determine what the appropriate method for outbreak response is, but they must have a policy. And any policy, I know I'll review in a few here, several other policies that they should have. And residents and their loved ones may access any policies that a home has. So don't be afraid to ask. Considerations of those outbreak response policies should include increased monitoring, contact tracing. They might consider vaccination rates or whatever symptoms are experienced. So keep in mind, all homes must notify the Department of Health of cases and testing results. These results are available for the public on the Department of Health website, both in general overview of each county as well as specific to each home. So you do have access to those important resources. The next, and often considered the most important aspect of this new guidance, is visitation. Homes must develop a visitation policy. Again, you have the right to view this. So I'm going to go over some key factors. There's quite a few, so bear with me. Visitors must sign in and out of the home. They must provide their contact info. This is in case there's an outbreak and they need to get in touch with you and make sure that you know you could have been exposed. Residents must be screened upon entry. Temperature checks, screening questions about your signs or symptoms, have you been exposed, etc. You can be, or you should, I say, you should be denied entry if you have signs or symptoms of COVID or close contact with an infected individual within the past 14 days, regardless of your vaccination status. Testing is encouraged when the community transmission is substantial or high. That's over 8%. They cannot require you to be tested, but they might encourage it. Visitors must be notified of outbreaks at the home and provided hand sanitizer and whatever infection control education is needed. Staff must assist with transporting residents from their rooms to common areas if that's the designated visitation location, and we'll go over that in a little bit here. Staff are expected to monitor visits to ensure that everyone's following appropriate safety measures, but they still must give you privacy. So they shouldn't be looming over your visits. Staff must sanitize visitation areas after each visit. And there must be adequate staff in order to accommodate for all of these requirements. So they can't just say, sorry, we don't have any staff to be able to accommodate visitation. That's not an option. Visitation hours, according to the regulations, they should be at least 12 hours, 7 days a week. We'll discuss a little bit more about this coming up here, but that is typically what should be arranged. Outdoor visitation is encouraged and preferred, but it's not feasible in our current temperatures. So that's not something we'll have to worry about until spring at least. Homes must allow unrestricted indoor visitation at all times for all residents. There are 3 exceptions to those circumstances though. So I'll go over the first here. If there's an unvaccinated resident and the community transmission percent is over 8% and less than 70% of residents are fully vaccinated. So there's a lot of caveats there. The resident has to be unvaccinated. This is to restrict visitation. The community transmission has to be above 8%, which unfortunately is the case in all of our counties right now. And less than 70% of residents would be vaccinated, fully vaccinated. You can look at your community's vaccination rates on the sites as well, which Jamie will provide links to. There are new definitions as to fully vaxxed or boosted or up to date. They're starting to be discussed, but it's not mentioned in this guidance, so you don't have to worry about that quite yet for residents. The second exception to unrestricted indoor visitation is for residents who have a confirmed COVID diagnosis. No matter what their vaccination status, until they're done with their isolation, there's no visitation for those residents. This is different for nursing homes, but for personal care and assisted living, COVID positive residents cannot receive visitors. And the third exception to unrestricted visitation is if a resident is in quarantine. If there's something that they were exposed to, potentially they may be in quarantine and cannot receive visitors. That there's lots of factors that come into play with the isolation or the quarantine timelines, whether or not they're immunocompromised, what symptoms they have, and the duration of any symptoms they may have. So that's quite a complicated calculation that I won't go over, but it's something that is in black and white to an extent. If there is an outbreak, unrestricted visitation will be halted at least until testing confirms that there's no additional cases. Visitation can resume in non-COVID affected areas of the home as long as they are closed off from the COVID infected areas. So depending on how your loved one's home is set up, this may be difficult. A lot of our homes have a difficult setup where there is cross-contamination potentially because airflow is the primary concern right there. Compassionate care visitation, if you've already been approved for that, that's wonderful because they may not restrict visitation as long as you have that compassionate care status. So if you don't have it already, it doesn't hurt to get it. And even as time goes on, if these visitation guidelines get a little more flexible, we'd still encourage you to try to hang on to that compassionate care visit status. So that doesn't matter whatever the resident's vaccination status is, or even if there's an outbreak, they still must let compassionate care visitors in. There is note of the essential family caregiver designation, but that does not currently apply to Pennsylvania since we pulled out of the state of emergency. So I won't bother to go over that since that does not currently apply. Homes are required to create neutral zones for both passing through if visitors are going to a resident's room or visitation rooms as appropriate, common rooms there. In-room visits should typically not occur if a resident shares a room, unless the residents are unable to leave the room, both the roommate and the loved one. So if that's the case, then infection control arrangements should be made to accommodate in-room visits, because that's really the only option for those residents. Keep in mind, infection control protocols still must be followed for all visitation. And I'll go over a couple caveats here. But residents and staff should wear a mask covering their mouth and nose at all times. They should perform hand hygiene before and after visits. They should remain in designated visitation locations. That might be a common area or a residence room. A 6-foot distancing from residents and staff. However, despite all of those caveats, or despite all of those requirements, the guidance also references that homes must comply with the recent CMS and Department of Health guidance, which states that residents can choose to have physical contact, including hugs or embracing, with their visitors. Residents and visitors can choose not to wear masks, but there's 3 points there that they must meet. So they can choose not to wear masks if the resident and all of their visitors are fully vaccinated. They can choose not to wear masks if the resident is not moderately or severely immunocompromised. Again, that's something for the physician to determine. And also, the visit should take place in the resident's room or the designated visitation room. So there are quite a few factors if a resident and or their visitors choose not to wear masks, although it is strongly encouraged. A home may limit the number of visitors per resident or the number of visitors in general visiting the home at one time if this could potentially put others at risk because you can't maintain that 6-foot distancing. So that's a calculation that will be difficult to make, and you might be able to negotiate, but obviously we want to make sure everyone's able to do so safely. Homes should provide masks to residents who can tolerate them. Residents should be strongly encouraged, but cannot be forced to wear a mask. So that is something that I'm sure quite a few of you have been dealing with, but we have noticed less and less residents wearing masks. So the tolerance level might be going down. But as visitors, we encourage you to continue to wear them. Children may visit with an adult visitor, but they must wear a mask if they're over 2 years old, and they must maintain those 6-foot distancing rules and must be well managed by the adult. They can't just be running around person to person. So that is a summary of the visitation rules, and I'm going to give you just a quick overview of a few other things mentioned in the guidance. Post-hospitalization. Hospitals must test residents prior to discharge, but homes that can meet infection control recommendations cannot refuse readmission of a COVID positive resident. To be honest, I was surprised that there are exceptions, homes that can meet infection control recommendations. So most of your homes probably fall within that guidance of being able to manage that, but there are obviously a few that cannot. Medical outings. Residents can be transported to medical outings by families as long as there's no known risk of COVID transmission. So masks should be worn. Of course, if the resident can tolerate it, and all residents and transporters should be screened upon return to the home. And there obviously should be ongoing monitoring of residents who go out frequently, like to dialysis, let's say. So they should be monitored for those frequent outings. For non-medical outings, the home must develop a policy on what can occur, what can be considered non-medical trips. This is not as flexible as the guidance for nursing homes is. So we'll review a couple key points here. Consideration of infection control and prevention, what can be accommodated within that outing. You can't expect to get a leave of absence okay for a rock concert or a packed sports stadium, but if you're going to a small family event where there's enough room for spreading out and people are going to be responsible during that outing, that should be a reasonable exception to let a resident have some fun there. Resident vaccination status and their immunocompromised conditions might be a consideration in homes policies as well. The duration or the location of the outing might be considered, whether or not it's an overnight stay or a trip out of state. Those are the type of things that might be included in those non-medical outing policies. Again, you have the right to review any policies. They should be available for public consumption, so don't hesitate, and don't hesitate to talk to your ombudsman as well, because perhaps we can have some input or encourage homes to be a little more flexible. And the last topic mentioned in this new guidance was communal dining and activities. That engagement can occur by residents when they are not in isolation or quarantine. They still encourage distancing and hand hygiene and masks, except of course when eating. Although, like I said, residents cannot be forced to wear a mask. At times they will say that an activity is intended for residents with masks and distancing, and if you can't do that, then it is a potential that an activity could be postponed or diverted in some way. So communal dining and communal activities are still restricted during an outbreak, at least until testing is completed. But once that's done, it usually takes a couple of days to make sure everybody's clear and there's no new cases. Everyone should be ready to resume. So they cannot just have flat out bans on activities and dining and visitation. This guidance does allow quite a bit more flexibility than the last did. It's not as accommodating as the nursing home, but it's still quite an improvement from what we saw in last June's guidance, which is the last update we had. So that's all I have. Anyone have any questions? I see a question here. Can you clarify the requirements for staff? Are personal care home employees required to wear masks while in the home or working with a resident? Yes, staff must be masked at all times.
And there's another question in the chat from Kay. Mask being worn by residents if they can tolerate it. Can you be more specific about that?
There really isn't any guideline on that. It's pretty much willingness. They are strongly encouraged to, but they cannot be forced. So tolerance is along with willingness, essentially.
I don't see any hands right now.
Hi, it's Patsy. I have a question. I'm driving. I can't put it in the chat or raise my hand.
Go for it.
So personal care homes, what is their responsibility as far as notifying residents or family members of positive cases, either resident or staff cases in the home? What's their responsibility?
They should be notifying residents and and their designated representatives of new cases, particularly when you walk in the door. Any visitor to the home should be notified of a current outbreak. But in general, communication has been a real struggle during this whole past 2 years. And we're not seeing really what residents and families should have. But yes, they should be notifying you of any new cases within the home.
Okay, I mean, you're probably sick of hearing from me, but I work at a nursing home and we send out a letter. Sometimes it's twice a day. Anytime there's a new staff or resident case, a letter goes out to everyone. But where my mother's been for 3.5 months, I have never been informed until now when they completely shut the building down for 5 days. So, that's troublesome for me, but I'll speak to them about that.
Absolutely. I think there are homes that are doing a whole lot better at that. And unfortunately, there's a lot that are not relaying that in a very effective way.
Right.
But I would encourage you to definitely speak up about that, because I think they're so frazzled with probably whatever's going on with cases and testing and all of that. I think they need to recognize that communication is essential as well.
Right, no doubt. This has not been friendly for anyone or helpful to anyone.
No.
Thank you for indulging me.
Oh, no, thank you. We could use your input as a nursing home staffer too.
Absolutely.
Anything you need. Yeah, it's been a fun 2 years. We just opened today, finally. Our units all opened today. Yeah, it's been a struggle.
Well, thank goodness for that.
Oh, hallelujah.
We hope it stays that way.
Oh, I hope so too. And the stickler now is a couple unvaccinated residents, that you just can't convince.
Yep.
So that took some, finagling around.
Absolutely. And that is why I mentioned so many times that both community transmission and vaccination status, those are really big factors in whether or not you can have some more flexibility with outings and visitation. I know there's a lot of people that are reluctant, but even if that's your only reason, it will be a great benefit to the resident.
Mm-hmm. Right.
I have a question. Do you think there is a way jumping over to the nursing homes, a way to enforce the staff getting their vaccinations, because that date is right around here now?
Yeah, I think in a couple of days, they all must have their first round. There's a couple of exceptions for religious and health reasons, but from what I've been hearing, they're being very strict about those exceptions. So that's not just something they're giving out willy-nilly. So yeah, I mean, within the next couple of days, I think we'll find out. And these are stats I think Jamie will be able to tell you some more about, that you can look up your resident and your staff vaccination statuses. They update them every week or two, but they must report those. And it's really going to be hopefully the beginning of the end, at least for surges like we're experiencing. So by the end of February, they must have their final full vaccination. But like I said before, there's new information out on what fully vaccinated actually means now. It actually means boosted. So we're getting there.
All righty. I don't see any more in the chat or any hands up at this time. So
there is a question in the chat. In what way has it been a struggle for residents and families or staff communicating with one another? How do we overcome this hurdle?
I've found that a lot. I hopefully families have some input here too, but I think creative communication has been really helpful. Facebook pages, blast emails, actual physical letters are nice for the people who don't have that technology, but you find out 3-4 days later, depending on the mail service, that there's COVID in your loved one's home. And staff are telling me they're too busy to make one-on-one phone calls. So it's been a major challenge. I think this is where we can use technology to our benefit. I don't know if families have some insight on how things are working out in your homes. I'd love to hear what's working and what's not, maybe. Is anyone getting those alerts? Whether it be twice a day is amazing, but anyone getting those notifications of COVID in the homes? As ombudsman, I can tell you I'm not. I wish I requested to be on those mailing lists, and they have not forwarded them to me personally. No.
I think there's a ton of factors that have been going into that too. I've been seeing a lot of administrative shifts too in a lot of the long-term care facilities. So maybe one had started using an email blast, but they may have taken the password with them, and you never know. It's very difficult right now. But I know even pre-COVID, communication between staff and residents was difficult at times. So this really made it that much worse. But that's not an unreasonable request to ask for things. So make sure you are, if that's something you need to know and want to know. They should be finding a way to share that with everyone. But thank you so much, Corey, for going over that. That was a lot of updates. And
yeah, sorry, blurt.
Oh, that's good. We need all the information we can get. Speaking of information, these are the resources that we're going to review today. Some of these might look familiar to some of our ombudsmen on the call, but we wanted to make sure that everybody knows kind of how to navigate these. And some of them can be a little tricky if you don't know what you're working with. So we're going to go over that specifically today. We're going to show you how to find the personal care home directory, the regulatory compliance guide. So this is going to tell you a little bit about the regulations for personal care homes and then the assisted livings. We're going to go over the Department of Health locator and how to find the surveys on the site. And then we're going to go over some other more national programs that really can share some information with you. So we'll go to the Consumer Voice, the Long-Term Care Community Coalition, Justice in Aging, and Center for Medicare Advocacy. I didn't cover all the ones that we're going to provide on the email follow-up, but we're going to give you a 2-page list of clickable links that the ones that I'm talking about this evening, you'll get that tomorrow. And you can just click right along. Hopefully it'll all work out well for you. If not, you know how to get in touch with us. We'll make sure we can help you get there. So our first one is the personal care home directory. So if you click on the directory, this is what's going to come up. So one important thing to realize on this website is it covers all of the Department of Human Services providers. So you have to be specific with your service code. You have to drop that down to personal care homes there, and then fill in what county you would like to look at. And then it'll populate all of the licensed facilities in that county for you. So for example, this one I did personal care homes, and I just clicked randomly on Erie County. So Erie County has 26 providers. So some of the information that you will see, here's just an example. It'll tell you, who owns the facility, their address, their contact information. It'll give you the bed count. So whatever they're licensed for, if they're for profit or nonprofit. And then this part right here will tell you the inspection. So you can click on the inspection summary and see all of the information about their last survey. Another thing to look at would be their license status. So over on the far end, you'll see if they're full or if they're provisional. So the provisional ones usually, have not done well on their surveys. So that's something to keep an eye on. You might be able to see what's going on there. So this is an easy way on how to navigate these, and you can see exactly what's going on at your loved one's facility. They usually take a little bit to get these updated. So, have a little bit of grace with them, but they do get them up here eventually. And then they'll show you any of the certificates, waivers that they have. And these would be years of surveys. So you can click back, a couple of years to see how they have done. I always direct folks to this if they are coming into a new facility or if they have to transfer facilities. You're definitely going to want to look at the facility that you're considering on these websites. So we found the personal care home. This is how you find the regulatory compliance guide. So we're going to send you the direct links to this, and this will give you the entire PDF. And this, I always advise people, do not print this. The RCG is 261 pages. Please don't print it. Save the trace. You can use Control F and find anything in here. So for example, if you would put in meals, it will click through the guidance and show you everywhere that meals are mentioned. And it's fantastic. So you should more than likely be able to get your answer that way. If you get stuck, always reach out to your ombudsman, or you can contact licensing directly. They like to give out technical assistance. They'd probably be surprised that you have navigated your way through the RCG. So any questions on the personal care home before we flip over to the nursing home stuff? All right. So hopefully everybody has seen this page before, but if you have not, this is the Pennsylvania Nursing Care Facility Locator page. So this is pretty neat. You can click on whatever county you would like to see all the licensed nursing homes in that particular county. So for example, here, I threw Mifflin County in. So we got the facilities that they have. So one of the ways that you can navigate this is it's going to provide you with the facility name, address, contact information, type of the ownership, whether they have a regular or provisional license, which I said is always important to know. And then it's going to show you when their last inspection happened. So you can go under each of the facilities. They'll have view patient care surveys. You can click on every one of those and see. So when you click on it, this will pop up. So this was the first one on the list there. And you can see this is the inspection results for their May 25th survey. So it's kind of hidden in here, but you can click this down and go back probably 6 years worth of surveys. And every time that the facility has been, inspected in some regard. So this is going to be the one that you want to check, but they'll be able to tell you exactly what the findings were. That'll be in this report. So I know these websites are a little difficult to navigate. So that's why we really wanted to do this like screenshot walkthrough for everybody, just so you get an understanding. Because I know sometimes it can be discouraging if you're not a little tech savvy or you know what you're looking for. So we'll make sure we get these slides out to everybody with the links. And Jay wanted to tell us that we've had name changes for facilities. So you'll find those out on here as well. Let me see if this one has it. Oh, it doesn't have it on there, but sometimes they'll put the previous name in a parenthesis so that you'll be able to kind of know. You'll be like, wait a minute, I didn't know what that was called. So you'll be able to
your
see.
patient, Jamie, go back to your patient care survey quick.
Yep.
Look in there, O'Hessen Manor. That was the last time they inspected, and since then they changed the facility name.
There we go, Jay. Yep. So that's been happening a lot lately. And poor Jay gets all those updates. So I don't know how he keeps track of all of it, but we're very blessed to have you. So let me go back over here a little bit too. This will tell you how many beds that the facility has, but this one at the end too has been the number that everybody looks at. Nursing home hours per resident per day. So this is what we've been talking about with the updated nursing home guidance that we're trying to push for the 4.1. You can see out of the 3 nursing facilities in Mifflin County, only one of them is hitting that 4.1. So there's just something to look at and to consider, checking out your loved one's facility and seeing where they measure up with these numbers. All right. So the next one that we're going to look at is a link for the nursing home regulations in Pennsylvania. So when you pull up this link, it's going to show you a breakdown of all of the state codes into chapters. Unfortunately, the nursing home regulations are not as easy to navigate as the personal care home ones. I hope someday we can get there, but we're not quite there yet. But this one you can click down and it kind of gives you a little synopsis. So if it's something you have with physical site, you'll know what chapter to kind of jump under. If you continue down on this website, it has the links to the federal regulations. And then it also has some links about what surveys they completed for each month. So the last one that was available, I believe, is for December. So they have all of the facility surveys that they did in a big running list. And you'll be able to see that they're kind of categorized as to what that visit entailed. So if it was a complaint that they were out on, it'll give that complaint code, or if it was an annual survey, I don't remember the letters. I think there's some numbers involved too, but it has a little cheat sheet key to it if you want to check that out. And there's also at the bottom of this particular page, if a facility has had any fines or citations, that is also available on this particular page. And I think that one goes the whole way back to 2014. They were letting that, it's a running spreadsheet. So any questions on that? A little bit on this one too, is it gives a breakdown halfway through the page of how the inspection process goes for the nursing facility, which I think is pretty neat. They're usually there for 4 to 5 days doing an inspection, depending on how big the facility is and how many inspectors they have available. All right, so now we're going to jump into some of the national ones that we have available. One that we talk about a lot on here, and they've also been a presenter a few times, would be the National Consumer Voice for Quality Long-Term Care. So if you haven't stumbled upon their website, I would highly encourage you to do so. They have some amazing resources there, awesome fact sheets, but they even have a way that they can specialize it. So I know if you're a family member, they have a special tab. You can just click on that and they'll kind of show you all the things that would be important to you. We usually pop in under the advocates one because us as ombudsman, that's what we like to do. But the consumer voice, they're always looking for the consumer's best interest. They want to help to ensure and empower them to advocate for themselves. They are a primary source of information and tools for consumers, families, caregivers, advocates, and ombudsmen to help ensure quality care for the individuals. So some of the things that they do, they advocate for public policies to support quality care. They communicate with CMS quite a bit. They were doing a big push on the visitation that we just got, reinstated through CMS. They empower and educate consumers and their families with knowledge and tools. Like I said, they provided training for us a few times. So they have a lot of cutting edge, up-to-date things. I know when I jumped on quickly, I've seen things that were as recent as last week up there on their update page. So it's definitely something to check out if you're interested and you want to stay, on top of things. Consumer Voice is a good one. Another good one that we have, the Long-Term Care Community Coalition. This one, they're a nonprofit organization. They're dedicated to improving quality of care, quality of life, and dignity for elderly and disabled people in nursing homes, assisted living, and other residential settings. So they focus on systems advocacy. They research national and state policies, laws, regulations, all those things. There's a wealth of information in their data center. I would highly recommend you to, if you have a few minutes, check out their data center. There's a lot of information in there. So there's another resource. And the next one is Justice in Aging. This is a national organization. They use the power of law to fight senior poverty by securing access to affordable health care in the courts for elder adults with limited resources. So they train and provide free resources to thousands of professional advocates and legal aid attorneys every year. So they are definitely on top of a lot of different things. They watch all of the legislation that comes across. They do a lot of good updates on that and kind of do a call to everybody if there's things that you want to be changed and what they think needs your attention. Because really, in regular day to day, you don't really come across things, but Justice and Aging is really good about bringing it to the forefront. So if you have the opportunity, definitely pop over to their website. They have a really good newsletter as well. They have a lot of publications that they put out. I think they're about weekly, that the Justice and Aging ones, if not more often. I haven't seen one in a while, but for some reason, my spam blocker does not like the Justice and Aging server at all. But I know they have a lot that they send out. Lots of good information there. And the last one that we're going to cover, the Center for Medicare Advocacy. So this one is a national nonprofit law organization too, that they want to have access to comprehensive Medicare coverage, health equality, and quality healthcare for older people and people with disabilities. So they've been around since 1986, and they do a lot of system advocacy as well. They have their headquarters in Connecticut and Washington, D.C., but they have a couple pilot offices as well. There is a wealth of information on this website. So another one that would be a good one to check out. In the email that we're going to send out that Corey was referring to, we have a lot of COVID specific links that I didn't jump into just for time, because I know everybody likes to kind of pop off here at 5:30. But when I send out the resource links listing, the second page is all COVID-19 related. So that'll be PA specific, and the national CMS is all included on there. I think there's at least 8 different links that'll take you exactly to that information. But if anybody gets stuck, don't hesitate to reply to your email and we'll get you there. So any questions or comments?
I don't see any hands right now.
And I don't see any questions either, just that you will be sending the links out tomorrow.
Absolutely. I'm going to launch our poll real quick. Give everybody a little bit of time to answer those 2 questions.
Jamie, I don't know if you included this one in your resource, but I put that in the chat as well. The Medicare Care Compare site is really great about really breaking down things.
I have that one on there as well. Give everybody about 10 seconds to finish that one up. Well, it looks like a lot of folks have seen some of these resources, but it looks like everybody's going to at least try them out if they haven't. So that's wonderful. We'll definitely get those out to you first thing tomorrow. I want to make sure they're clickable links for everyone, so it's very easy to navigate.
Jamie, one thing I wanted to add about the Pennsylvania nursing home directory, if you don't want to limit yourself to a single county, just hit the search without clicking on anything, and it will provide you with all 689 of the state's facilities in one search.
That's a little overwhelming for most folks, Jay, but thank you for sharing. Alrighty. So I don't see any other questions or comments. So we are going to review our upcoming meeting topics. So we do have February presenters all set and confirmed. So on the 8th, we're going to get a presentation from Community Health Choices. So Sarah Rittenauer is the manager for the long-term, I can't even remember what the second S is, something services, behavioral health and collaborative services, Community Health Choices. So she is going to talk to us about Community Health Choices and what all they can do for folks in a facility and if you would want to transition to the community. So that's going to be a really good presentation on the 8th. And then our last meeting on February 22nd, 22, that's a lot of twos. We're going to hear about sexual expression and intimacy and long-term care. So we're going to hear from the Director of Social Services from the Hebrew Home in Riverdale on that one. So we're pretty excited to have our February meetings with these wonderful speakers. So hopefully everyone will join us in February. We look forward to seeing you.
Services and supports, Jamie.
Ah, thank you. I knew you'd know that, Jeannie. So thank you, everyone. If anybody has any specific questions, you can contact us at the State Ombudsman Office. You can give Jay a call at 717-783-8975 or shoot us an email at ltc-ombudsman@pa.gov, or you can hop over to our Facebook page, either on the main page or in our chat area. If you're not a member there, you can always request to join and we'll get you in there. So thank you so much for everyone for attending tonight, and hopefully you enjoyed the resources, and we'll make sure that we get that list out to you.
Thanks, Jamie. Great meeting.
Oh, thank you. Everybody stay warm and stay safe.